Among those who've died from coronavirus in the UK, Jewish people have been noticeably overrepresented. Using data from 6 of the largest Jewish burial boards and the Orthodox burial boards in Manchester, British Jewish communal representatives have been sending daily updates on the number of Jews who've died with COVID-19 mentioned on their death certificate. And they've calculated that up to and including the 1st of April, 69 Jewish people have died from the virus so far. Now, these figures include deaths from people who were not in hospital, and the government's own nationwide figures only include deaths of those in hospital. But the number still seems to be high for a community that represents less than 0.5% of the British population. There are various possible reasons for this, but it seems most likely that the virus has simply been able to spread effectively among this community because of the nature of synagogue attendance and prayer. People gather together in synagogues and communal centres in close and large crowds and then travel home, potentially infecting their family and friends. The timing of the early stages of this outbreak also saw one rabbi test positive shortly after Purim celebrations in his synagogue, for example. And that would have been a time when lots of people came to the synagogue, including children, and then went home and gathered as families in other religious settings. So you can see how this could have spread. Indeed, the ultra-Orthodox are perhaps more likely to engage in synagogue worship and collective groupings, whether they have larger families in smaller dwellings as well. These are all things that might have played a part in those members of that community perhaps showing higher rates of infection.